So we've been talking about this for so long, and this is the 10th version or maybe 11th version of the same presentation. So what we started is we started working with three different PR companies to come up with the idea for the day, considering what Engage can do and what we can achieve and what we want to do, with the small budget that we have, pretty much. And then we decided, with one company, and they're the ones who are going to be handling the campaign. They're out of Turkey. They're amazing in social media. They're very strong in social media. And we told them that, we have such a great network and great non-for-profit, so we'll be able to do an event, so we don't really need their support on that end. But we will definitely need, some Google ads, some informative infographics and stuff, which they're great at. So the day will be celebrated. It's going to be the day itself, September 20th, in two ways. One in social media, and one will be in activity that day alone. So I'll give you the details, but I just want to give you an overview of what has been done. This has been presented to ESGO. This has been presented to Engage EEG. So, and it has been changed many times. So this is kind of a final. And from this point on, we're going to continue, and we're open to your comments on, what can be done in different countries, etc. It's going to start, I'm saying it's going to start small, but we're hoping to have at least 20 countries celebrating the day and bringing the attention to the day itself. When we were trying to find gynecological cancer survivors in the countries that we are active, it was so hard. Either the famous people don't come out and say they had the disease, or they're diagnosed at the late stages and they don't even talk about it, and then we don't know. So we have a long way to go. I think we have to get those people that give them strength to come out and say, like the breast cancer society is where it is right now. That's one of the things that we're hoping for with this day. Maybe not in the first year, but as we go along together, as we celebrate, it's going to bring more attention. So let me start the presentation. You see the Social Touch as the company who's going to be celebrating, who's going to be helping us celebrate the day. It's going to be September 20th, and we're going to go over communication plans. What we have, what I'm going to present to you is the campaign objectives, the target audience, tone of voice, the mechanism of the campaign, and we have some, information on the logo, the messages, the event, and also some strategies that we're going to share with you on digital media. Let's start with the communication approach. The campaign objectives has been discussed and decided almost by Engage. All of us, we've been talking about this at the patient seminar too, and we know what we're missing. So this is what we want to achieve step by step. The first one is to raise public awareness of the impact of the gynecologic cancers on women and their families and friends and caregivers, pretty much, and the unmet needs in the management of the disease. What we're missing in the whole management of the disease. Then step 2 will be mobilizing the stakeholders to advocate for better outcomes for patients through greater awareness around the diagnosis, the risk factors, the treatment options, the holistic approach to patient care. So it's not concentrating on one type of gynecological cancers, or it's not concentrating only on prevention, for example. It's every step of gynecological cancers. And then the last step is the established September 20th as the Gynecological Oncology Day, and bring it to the global level. We're starting this as Engage. We're promoting this, in Europe, but it's open to non-engaged members. It's open to public. It's open to every country that you can think of. For example, I have a conference call with American Cancer Society in May, and I'm going to be meeting with them at ESGO. And I've spoken to SGO, and I have spoken to World Ovarian Cancer Coalition. They're all in to help us celebrate the day. So we're trying to make this, us as a starter, but everybody as taking a part. You will see that on the target audience. that I have on my screen. So we're going after general public. How are we going to go to the general public? With the patient advocacy groups, which will be engaged members, and again, any other organization that you might think of that would like to participate in this, they're more than welcome. Healthcare professionals. So we're in touch with ESGO. So ESGO doctors are going to be helping in local countries and working together with non-for-profits. We were very lucky to have their support. I am going to be at the board meeting in June at ESGO, and we will be sending a letter to all ESGO members, over 3,000 members, this month, telling them about the day and telling them about the support that we need. So hopefully, it's not only non-for-profits trying to do something. It will be everybody getting together. Also, the pharma companies who are supporting this globally, which are so far, excuse me, we have AstraZeneca, we have Clovis, Pfizer, Merck, Tesaro probably, they submitted their paperwork, hopefully Roche. So they are supporting World Gynaecological Day globally. But as I speak with them, I told them that once we inform engaged members, I'm going to ask them to go to their local, let's say we're in Italy, to go to local Italy and put my nonprofit in Italy's or all the groups in Italy on the same email with local Roche and tell global pharma company that, this is something we're supporting globally. We want you to support locally as well, get part in their activities, support them, any kind of monetary support that they can do, because global and local budgets are different. So we're hoping to give you a little more support on the day itself for the activities, for the balloons, for printing the leaflets, et cetera, et cetera. So, any question? I'm sorry, did I miss it? Any questions?
No, thanks. No. I didn't quite catch perfectly. What did you say about Italy and Roche? That Italy should go to the Roche?
It was just an example. No. What's going to happen
it was an
is,
example. Okay.
The pharma companies, that are supporting this initiative globally, we're going to hook them up with their local people. So I'm going to ask, the companies who are supporting to the Gynaecology Day so far is AstraZeneca, Clovis, Pfizer, Merck, hopefully Tesaro, GMAB. They're all supporting. So if they have an office, a couple of them don't have. GMAB I know don't have. If they have an office in Italy, for example, I want them to support you locally in the event on September 20th. So if the global team goes to their local team and say, because the global is over them, it's like their boss, and tell the local.
They should contact us. We have to wait for them to contact us. We are not proactive.
No. You're not going to contact them. I'm going to ask the global. Yeah. So we're going to start from the global to them, and then from there you can take it over and say, we need T-shirts, we need balloons. You're going to see the activity. We want your people to come over. Maybe we can do seminar. There are two things that we require from you on the day. But if you want to add anything, let's say if yoga works for Italy, if that's something that you really think that you can bring attention, like seminar in Turkey for some reason works. So Turkey is going to do the sports game and also a seminar, for example. And you will need money for this. I know I come from non-for-profit, so I'm trying to get those local pharma help you with the expense of the day itself.
Yes.
Okay. So the target audience, these are the countries that we've been working on. How their digital people, how their social media is working, etc. And we will the page itself, the website itself will be in English, but we will also have translated material for you. Well, for example, as a start, we have the leaflets. So let's move on.
Okay.
I think I'm moving ahead of myself.
Okay.
Tone of voice. This is if the campaign was a person, this is how the person will, will present the campaign itself. It's friendly, it's encouraging, it's warm, it's professional, and the language will be very serious and simple and fun, so we can have people engage on social media. The tone will be personal, direct, and honest. That's really important. And the purpose of the campaign is to engage people into the campaign so we can be heard, educate people, go get your checkup. Did you get your vaccination? Do you know the signs of ovarian cancers, for example? That kind of stuff. So that's what we're trying to achieve with the campaign. The mechanism is going to be, the first step will be aware. So from engaged side, for example, we're letting engaged members being aware of the campaign. And then 2 will be make your network aware. If I think about you, for example, as your organization making aware of your members, of the caregivers, of the other organizations in your country. Again, this doesn't have to be limited to engaged members. It's open. We started thinking about UICC's World Cancer Day. Everybody knows UICC is behind World Cancer Day, but it's not. It's an initiative that they started, but it's worldwide accepted. So we have the same concept. And number 3 will be taking action. So we're going to ask people, go get vaccinated, go get your pap smear test. Did you go to your doctor? Did you get your checkup, etc. Any questions?
No, thanks.
No,
Okay.
thanks.
Hopefully I will be able to show you the video and you'll be able to hear it. The video is not final. The words, I just tweaked some of the words, so the order of the words are going to be different.
Ma cos'è sta roba?
All right, so this is the launch video. Again, the words will be changing a little bit, the order of the words, but that's what we will be using much prior to day itself. I want to tell you a little bit about the logo story. I hope you like it because it, you're seeing the final version, but it has changed so many times. So we started with the idea of engage, and then World Gynaecological Oncology Day, and then it became Go For. Even if people don't know English, I think it's very easy to see when you see Go For. It's Gynaecological Oncology Day, but Go For is very open. It's very engaging to people so they can actually share it. The logo started with the women's reproductive system. If you look at it, it's similar to that shape. And we had the ribbon colors from all gynecological cancers, and then we added Go For at the end. So we came up with the logo. Do you like it?
Yeah,
Any
I like
comments?
it. No, I like it. I think it has sense, and yeah, it's a good idea.
Okay, wonderful. Okay, it's just, I'm telling you, you see this final product, but we worked on this for so long. It just looks like, oh, it's just a simple, but it wasn't. So I told you the story, and then we're going to go into slogans and messages. So remember the 3 steps that we were taking with the men walking up the stairs? It's pretty much the same thing. The messages are going to be sharing the same thing. Awareness, making your network aware, and then take action. So the slogans that we're going to use through the campaign is going to be, all women have a risk of gynecological cancers. This is just examples of the messages. You can reduce your risk by going for a regular checkup and getting a test. Go for vaccination, go for examination. And then make your network aware. The more you share with Go For motto, trying to get people engaged into the campaign on social media especially, prior to the day, as we said, and use Go For anything that you want. And then making an action. Going to the doctor, convincing a friend to go for pap smear, get the doctors involved, etc. And we were talking about this yesterday too, because we had another webinar yesterday. Most of the materials, the website itself will be in English, but we will be able to, there will be a part where you can actually upload your photos and videos. So I'm thinking, non-for-profits, you guys can even just do a video with your phone in your own language. You can do it with a doctor, or you can do it with a survivor. Like, I don't know, 1-minute videos in your own language. We can just put that on our website too, on worldbowday.org website. So there will be things on the website, not only English, but also directly from your end. Doesn't have to be professional again. It's more important just to show that there are a lot of people who are engaged, a survivor talking. It's more powerful than we trying to say something in English. All right, so the event fiction. Again, this has been reviewed many times, and then we agreed that sports is a common interest of all countries and people. And it will also bring media attention if you use one kind of sports. First, we started with the basketball, so the slides you're going to see will be showing basketballs. But then, as we voted that basketball is not the in sport in every country, we're giving 3 different options. Either one of them: basketball, volleyball, or soccer, I believe. Is that what it was, Hannah?
Yes.
Okay, so either one of them. So it's kind of organizing an event. If, let's say, basketball, it's not going to be a real basketball game where people are pushing each other and running each other. This is survivors with the healthcare professionals playing together, getting together, giving the message together. So it's going to be a game of attendance. It's going to be about the attendance. It's going to be symbolic. So the survivors don't need to play unless they don't want to. It could be 10 minutes each time. So it could be healthcare professionals, doctors playing, family members. I had that vision of survivors kind of cheering for the caregivers and for their doctors. I think that's a great way of doing it. And then if you want to wear the T-shirts with the survivor's name on it, that's an option too. So they can be part of the game itself. Each country will be organizing their own game. So, that event itself, it requires a little bit more help and organization, and of course a little bit time and also money. So, but this is very important because we're going to be doing this game, the survivors with the healthcare professionals in 20 countries at the same time. So it's going to be a game against gynecological cancers. We're scoring against cancer. We want to beat cancer. Let's go for a win. That will be our motto. Any questions?
No.
No.
Is that feasible? Do you think that that's something, if you get healthcare professional support and local pharma company, that's something that you can definitely do? In parentheses, I'm also going to tell you the PR company will be giving you a presentation, PowerPoint presentation about the day itself in English. But if you want to take this to any other non-pharma companies and you want to present them today and tell them this is going to be global, do you want your logo on this? This can be any companies that you have contact with, and tell them, do you want to be part of this global day? And then all you need to do, I don't know, find us a court or print the T-shirts or print the leaflets, etc. We'll be giving you the information to be able to go out and get some more funding. Okay, I'm going to go into digital media. This is all going to be handled by the company who we're working with. We're going to be placing Google ads. We're going to be doing YouTube ads. And they're going to be providing us with the social media content. The website itself will be in English, as I said, and we've been talking about this. The infographics will be in English as well, but the English version will be uploaded into the website where you can download. It's the same concept as the UICC, but World Cancer Day. But since they're so big, of course they have it in 15 different languages in there. We're not there yet. But if you come up to us and tell us, oh, I need this in Italian, this is what it's in Italian, can your team work on making this JPEG for us? The company is willing to do that. They cannot translate, but they can definitely do the art for you. Did you have a question?
No,
Yeah.
no.
No,
Okay.
no.
All right.
No, it's
I don't
clear.
want to talk over. Okay. So we talked about the ad strategies. I should have deleted this. Well, actually, influencers. We will go after maybe famous basketball player. I found it easy to contact people if they had gynecological cancers in their family, or if you know them by person. For example, I went to school with a girl. She's on top of media in Turkey right now. So if I go to her and say, this is what we're doing for women's cancer, can you please share this on your Instagram? It's much easier to use your local contacts. It's harder for me to come from United States or Turkey and ask, an Italian famous soccer player, for example. But we want you to think and try to see how you can get influencers, how you can get famous people to get involved with the project itself. Again, it's global. I think it helps that it's global, so they would want to be a part of it. Any questions?
Who will be the winner? On the last slide, you have on September 20th, we will give an award to winner.
No, this slide, this was on the original one. We were gonna do a gamification, then it was too much activity for everyone, so we decided to take the gamification out for this year.
Okay.
There's so much you can do, but Veronica was asking yesterday. She goes, "Are we limited? Doesn't everything have to be approved for ESGO by ESGO and Engage?" Definitely not. We're just giving you the material. 20% of the day. You have to do a sports activity, and you have to use the hashtags and stuff. But whatever you want to add to the state in your own country, it's perfectly fine.
Okay.
So you're not limited to the stuff that we're giving you. You can use your own leaflets. It doesn't have to be engaged leaflets. We want to reach those women. We want to make sure that everybody knows we want to save lives. So there is no limitation on anything. You know what I mean? Whatever works, as I said, yoga works, seminar works. You will do 10 minutes of basketball, mini game, and then after that you'll have a seminar, or you'll walk, or you'll light a monument. Whatever you can do. It's all open to your imagination, and every country is different. So, definitely make it your day. It's not an engaged day. Make it your day. We just want to give you the support, the global support, and also local support and then make it bigger and bigger every year. So this can definitely become a day where women are going to come out and say, hey, I'm a survivor. Did you get your pap smear? Did you get vaccinated? These are the rates in this country. I shared on Facebook, you probably saw it from my TV, how the vaccination rate was low in France, for example. We want to be able to change that. We want to make an impact in that country and say, hey, these are the rates in France. You can actually finish cervical cancer. Let's go for vaccination. That kind of thing. As I said, it's open. You know more what big issues are in your country. Vaccination may be big in France. It might not be a big problem in Italy, or it might not be a problem in Czech Republic. Veronica was saying we don't have a problem with the vaccination. We're more about the testing, BRCA testing, etc. It's okay. So
Yeah.
it's open to what you can get and what you can improve in your own country. It's a little bit tough to make it in make it fit in every single country. This is the hashtag you see. It's Go4, and we talked about it. So the main idea will be using the Go4 hashtag. And Gynecologist Day, let's say if you're sharing something about the cervical cancer, just add hashtag cervical cancer to the end. So if somebody is looking for information on the cervical cancer, or information will come up. We'll be happy to share your pictures. We'll be happy to share your, again, in your own language, whatever you're doing on the website itself. The website, let me look at my dateline. They are working on the website, and you will see, I'm going to jump over here. This is the website structure. We will have pretty much most of the content in the beginning of June. So they're working on the web structure, and then they have to send it for approval, and we will start sharing infographics, etc., a month and a half prior to the day. So by August, we're going to start the campaign a little bit. We're going to bring the attention. We're going to share information, etc. Here are the website structure. It's going to be a tab for About Go Day, the campaign objectives, the events, the media, the press release that the PR company is going to be doing. It will be in 10 different languages. So we will give you a ready Italian, for example. I'm giving Italian as an example again. We will give you a press release for you to share it with media. So it will be ready for you to be shared with the media, so we can bring media attention as well. There will be a tab about ESGO and ESGO Engage. And I requested yesterday that we'll have a tab about the supporters will be the pharma, but there will be another tab about engage members who are taking part of this day. So we're going to ask you probably what we're going to share for the patient seminar. We're thinking about having a page for each member who is going to be there. We'll put the same thing on this website, worldgynecologicalorg. The second tab will be Go for Awareness. What is the gynecological cancers, the issues about the cancers, frequently asked questions, and resources. On the resources, as we're going to be working with other organizations, for example, SGO has amazing videos about gynecological cancers, and I told them, I said, we'll be happy to share your videos in here so it can reach more people. American Cancer Society has great information. So we'll be sharing not only engage resources, but also their resources that they will be part of this day. And the action point is the pap smear, the vaccination, and warning signs. Each applies to different gynecological cancers. And then share portion is the stuff that we will share from you, what you're doing in your country. And we'll have a map there. It will show the activities per country. So when you click on Czech Republic, you will see the stuff that Czech Republic is seeing. So that's pretty much it. Any questions? Any concerns? Any comments? So we can make this better?
I have to think about it. So,
No, I understand. As I said, this is the 20th time I'm
yeah,
seeing this, so this is all new to you.
what I have in mind now, do we share our events in some website, on some website, or for bigger impact? As I remember the World Cancer Day, they had a map on the day website, and
Yes,
each
we have
country
the same
can
thing. Yeah, we
contribute.
have the website. The
Yeah,
website is ready.
so
Facebook
we
page
will
is
write.
ready. It's just empty right now. And we have the
Okay, so
Instagram page ready. So it's worldgoday.org.
yeah, okay, and we will put our events there and have so big impact on all the world.
Per country, exactly. So
Yeah.
you will be
Okay.
seeing, your organization on that website, and website is going to be active at all times. It's going to be very active for 3 months. But we'll still continue putting stuff in there because once September 20th finishes, then we're going to start working on the next year.
Yeah. Okay. Okay. Thanks.
So your organization will be visible too. I just want to make sure that, as I come from non-for-profit, I know the problems. Being a part of global project is very important. It's going to help you in the future with your, government issues. If you want to go to your local supporter, if you're going to be saying, oh, you know what, we were part of the World Gynaecology Day, you can just click on this link and see our activities. I think it's going to help you in the future to get more funding locally because you're going to be part of the big thing. So I just want to make sure that, we support you with visibility.
Esra.
Yeah.
Okay.
Esra. Is it possible to have this presentation to our email? So it would be nice to read again.
This was asked yesterday as well. Camille from Poland asked the same thing. I have to correct a couple of English, on this presentation. We will definitely send this to you, but it will be for you. Because there will be another It will be another presentation for outside your company with the motto of the campaign and stuff. That's going to be coming directly from the PR company. And I'm looking at the PowerPoint presentation. Hold on. Sponsored PowerPoint presentation will be done mid-May. So you will have. You will have visual. You'll have the final video. You can send the video will be uploaded to the website World Go Day. So we'll have material by the end of May to start going out and sharing.
Okay, thank you.
Okay.
Yep.
Okay, thank you.
Okay.
Okay, good.